Today we're just going to go through setting up a basic chart for a patient visit at Restore PDX. When a patient has been checked in, they will go from this side of the schedule onto this side of the schedule. They'll appear here, and that means that the front desk has checked them in and they're ready to come back and see the provider. The MA or scribe who will be getting the patient from the lobby, and before you go to retrieve the patient, I recommend and we prefer that you set up the chart in a standard and appropriate manner. So the first thing to do is, if you know you're going to get the patient and you know which room you're going to put them in, you click on their name and then you select in room, and then you put which room you're going to see them in. So we're going to put them in exam 3. Next, what we're going to do is open up the chart, and this would be what a new patient would appear as. Here there's nothing filled out for this patient, and that's okay. With their new patient paperwork, we can go back and fill in their allergies, their family history, their medical history, their social history, and their ROS will be part of the new patient paperwork. If it's a return patient, the family history, medical history, social history, and allergy should already be completed. So you can copy those forward from a previous visit. The ROS, if they're a returning patient, they will get a new ROS, and we will want you to record that. But before we get there, you still have yet to retrieve the patient. What we're going to do is copy a template. We're going to copy over the basic exam. So you go to copy template. We're going to deselect all of this, and we look here to make sure that it says basic exam, and we copy that to the examination section. And then, based on scheduling, we should know what their chief complaints are. We want to fill those in before we grab the patient. So let's say it's low back pain going down the leg. Next, for the HPI, this is where the person who is rooming the patient will fill in the pertinent information. What we really like to emphasize is filling in the visit type. If it's a new patient, then it'll be an initial consultation, and that's all you have to push. If it's follow-up, you can select from follow-up to review MRI, and commonly we have follow-ups post-procedure. For instance, if the patient is following up from let's say a left sacroiliac joint injection, we'll click the post-procedure follow-up, and then you just click other, and you can free type left sacroiliac joint injection. Always spell check before you close the free text box, and now the reason for visiting today is on there. And you can fill in the issue type 1, which is going to be their chief complaint. Low back pain with left-sided radiculopathy. And again, always spell check. Okay. So now we're ready to go get the patient. We get the patient from the lobby. Mr. Brett, please come back. And the first thing we do is get their height and weight, and that it can be entered in vital signs. Here you can enter their weight in pounds and their height in feet and inches. Then we take them into the room. We get their blood pressure, their pulse, and respirations, and also their pain score. That is usually indicated on the bottom of their ROS form, and we'll save that into their chart. We want to get those vital signs with every patient visit. We want to have their chief complaint documented on every patient visit. And we want to confirm their allergies every patient visit. To add allergies, you go into here, add allergies, and then you can either NKDA is no known drug allergies. So if they don't have any, you click that. If they do have some, there's some common ones on here, or you can just free type it in. So we're going to say no known allergies, close that, we're okay there. So it shows up there. Current medications. We want to make sure that even if they are a follow-up patient, that we make sure we're up to date on the medications that they're currently taking. Or if they're not taking any medications, mark patient as not taking any medication. If they are taking some, then you can just free text it in and search, and it'll show up and it'll ask for the dosing. So let's say they're taking 20 milligram lisinopril. There we go. Okay. So Mr. Brett's lisinopril is on file. And now we're in the room and we get their HPI. So with the HPI, we'll ask them the standard questions. If it's a new patient, we want to be very detailed in our HPI. We want to document where exactly the pain is located, how severe their symptoms are, what the quality of their pain is, if they have any neurologic deficit, if they have any muscle weakness, if they have any limitations in their activities, daily living. We also want to document what treatments they've tried in the past. It's important to know if they've tried NSAIDs, medications over the counter and prescription, physical therapy, chiropractor, massage, all of those, and let's document their response. A lot of times people will have come to clinic and they have already tried gabapentin or they've already tried these medications. We want to know if it worked for them and or what doses they've used it at, just so that we can use that in our reasoning. So in here, as you're getting those answers to the questions, you can type as you wish and spell check before you close. So that's the basic HPI. At this point, once you get the chart ready with the visit type, the HPI, checked medications, checked allergies, you have vital signs, you have the examination template ready to go, now you can step out and go get the provider and fill the provider in, and then the provider will come in the room and they might ask a few more questions about the HPI just to get clarity for themselves or if something was missed. If they do ask questions about the presenting chief complaint, please document the response in the HPI, even though you've already done your job. Mark what the provider has been questioning and the responses. Once the provider is in the room, then we will document the examination. There are videos that will help you be able to follow the examination as per whichever is the complaint area. One thing to note is in medical history, this is where we keep track of injection history. This is pretty important for us at this clinic as interventionalists. So oftentimes people will have their general high blood pressure and allergies and such marked in their medical history, but in the other category, we'll have a topic called injection history. And here we'll have a date followed by the injection that they've had. What we'll do is we keep track of those so that we have quick and easy reference to know what has worked for a patient, what hasn't worked for a patient. If a patient is following up from a knee injection or whatever sort of injection that they've had, it is often helpful to rank their response to that. So let's say this injection was a month ago, and they're following up 4 weeks after this injection. So we ask them, well, how did you do with that right knee joint injection? And they say, I am 50% better. Well, we'll type that in here in their medical history, 50% improvement, and since we're a month out, at 1 month. So then we can keep going back and referring, because we might treat other areas and use these injections diagnostically to narrow down where their pain is coming from and to determine potential targets going forward. There will be some instances where patients will be following up from a procedure that was done at the OSI, Oregon Surgical Institute. Dr. Michaels and Dr. Desai perform injections over there. If the patient is following up from a procedure over there, if you go into the document setting, in the notes, there will be, like this says Cornell Surgery Center, there will be a note similar to this, but it will say OSI, or Oregon Surgical Center. And we need to make sure that we input that procedure, so you'll click on it, you'll be able to see what was done, and you can type that into the medical history before Dr. Michaels or Dr. Desai get in the room, so that they know what was the most recent injection done. Now, once the doctor has seen the patient, examined the patient, and the treatment plan has been developed, hopefully as a scribe, you're able to keep up with the treatment plan as the doctor is delivering the plan. And this is the section where that goes in. So here, DX1, we'll just call it low back pain. It's usually what the chief complaint is. And then in other is where we will type the plan. So for instance, patient return, or let's say this is a new patient visit. Patient presents So here in the treatment plan, we'll say one line about why they're here, how long they've had pain, if they have radicular symptoms, what they've tried, severity of pain. And then we'll say a note about whether or not they have imaging and what the exam findings were. So exam findings. So now we have our kind of statement of correlating our exam with our imaging and our diagnosis. Next, we want to document what was discussed as treatment options. So oftentimes we'll discuss some sort of injections, such as a transforaminal epidural, and whatever the provider say. They'll usually list out the different options that you can do. So there we have our narrative plan, You can checkbox treatment options like so as well if you find that more effective. I like the flexibility of being able to type it in myself. Now, another important aspect to make sure we document is that we've discussed the upcoming risks and benefits. And then if we are going to proceed with a regenerative medicine injection, that we mark here noting the difference between a regenerative medicine injection and a standard steroid injection. If we are ordering an MRI, we'll indicate it on here, wherever the area is. If we're going to request a procedure, we can do it here. I usually just hit the requested procedure, scroll down to other, and type it in at the bottom. Left S1 transfemoral epidural with dextrose and dexamethasone. So we've got that. Considerations. Now this is where it gets a little tricky. If the provider will often say, well, I think it's coming from your disc, so that's why we're doing the epidural. But on MRI and on exam, your facets might be painful as well. So in the considerations, if the epidural does not alleviate pain, we'll consider lumbar facet injection. Now, what if the epidural is the right spot? If epidural beneficial, then we'll try to capture what the provider discussed. They may have discussed an epidural with PLM. They may have discussed intradiscal injection with PRP or stem cell. So try to keep track of those in the considerations, because that's kind of the next steps. One other thing to mention in the narrative of the treatment plan is if they have significant neurologic findings or limitations or red flags on their exam that the provider mentions, please make sure to indicate those there as well. If we order bracing, let's say if this patient was here for the knee and we were ordering bracing, we would indicate it here, medial or lateral unloader. And then for billing time, we often will want you to fill this in depending on how long the provider was in the room and how long the patient was here. We'll click the appropriate one. And if we reviewed imaging and the treatment plan, depending on education, and if we talked about diet or lifestyle, there's nice checkboxes to check there. Return to clinic. If they're having a procedure done, you can indicate what the follow-up after the procedure is. Or if they're following up after MRI or nerve conduction study, you can indicate that there. And then whoever is the one scribing the treatment plan, we like to keep track of that. So please click this box and it will automatically populate your name. If it doesn't, you can free text it in there. Now, in this case, the provider ordered a left S1 transfemoral epidural. Well, in order to get that, we need to make sure we have our diagnosis codes ready, and then we can actually put in the order. So for diagnosis codes, you can rely a lot on the imaging report to kind of help you narrow it down, but you can also ask the provider if you have any questions. But commonly for an epidural, what we'll do is look for a disc disorder, and for this person, they had pain going down their left leg, so that's called radiculopathy. So we're going to do intervertebral disc disorder with radiculopathy. We're going to add that. We're going to add disc degeneration. And just because people have disc degeneration or radiculopathy, they may or may not have low back pain. But let's be sure to include that. And that is under spine pain. Low back pain with sciatica left side. And this one was specifically, there was stenosis of the foramina, the neural foramen, in the lumbar region. So you can add that. So now that we have our codes, we can put in the order. This is a spine order, so we can go to spine order here. The codes will automatically populate in a prioritized fashion. And then you check the appropriate areas. Lumbar epidural, transforaminal, S1, dextrose dexamethasone. Put the provider signature and the follow-up. And then you hit save, and it goes to the authorizations department. I'm not going to save this one because I don't want to put in an order for test Brett for authorizations to get confused. So those are the basics of creating a chart note for our patients here at Restore PDX. So it'll take some while to get used to, and I'm sure you guys will find shortcuts and strategies that will help you navigate the system more effectively, but we need to make sure that we are capturing the proper information on each chart note, including chief complaints, current medications, allergies, vital signs, documenting the exam properly, getting a proper HPI. And then at the very end, you can do the super bill, and sometimes the provider will indicate this directly, or you can just assume it based on the complexity of the office visit and the time spent. Usually it'll be a 99213 or 99214. 99215 has special criteria that needs to be met, so if you have questions about which one it is, ask the provider. When you're finished scribing the note and the order is placed and everything is ready for the provider to sign off on the note, you mark it the gray so that they know that and they will review it. When the patient leaves, make sure to check them out in the time they were checked out. All right. Thank you.